Going to the topic, this is the inguinoscrotal sonography, the anatomy, the technique and normal. In patients with a metastatic germ cell tumor or unexplained retroperitoneal coverings, one is the tunica vaginalis, the outer one, and the tunica albuginea, tail of the epididymis, and it continues as the single which go along the septa into the testis. The testis to assess the size, echogenicity and blood flow by the Doppler. And erect scan also is done to study the varicocele or hernia. The hypoechoic muscle and the echogenic fascia, which contains also the hypoechoic structure as seen in the images. It may be echogenic, an arcuate movement which fixing the upper part of the transducer and make an arcuate movement. Now coming to the appendix testis, the embryological remnants, it is towards the upper pole of the testis. This is the normal variation of the testis. It to torsion. So this is a deformity, variation in the attachment which predisposes for torsion of testis on one side. It warrants contralateral archidopexy to avoid metachronic torsion of the contralateral testis resulting in. So this is all well described in the lecture on sonography in scrotum. Now coming to the inguinoscrotal region anatomy, as here as the oval echogenic structure containing multiple echopore structures. Then you trace it down. You can do a normal case like funiculitis, or when there is a congenital hydrocele or encysted hydromal testis by moving the transducer up or switching over to a convex transducer. So inferior epigastric artery, then it becomes extraperitoneal, crosses over the external iliac artery and vein, obliterated umbilical limits, and the vas deferens is seen in the scrotum behind the lower pole of the testis, and in the scrotum as a linear structure, transversus abdominal muscles which are cut and shown by the black arrow, and the floor is formed by the inguinal ligament. And it's a site of potential weakness of the arrow, yellow arrow, and it's medial to the femoral vein. The sites of hernia are, one is the epigastric artery deep to the rectus abdominis muscle, that is the rectus abdominal muscle, that is the inferior epigastric artery, and when you move down, that is the external iliac artery, or whether there is any hernia in the region of the internal ring. So that is the technique. So that is the inferior epigastric, and then you see the common femoral artery, common femoral vein, and medial to the common femoral vein is the femoral canal. So that is the inguinal hernia and the femoral hernia. The difference is, it is the inguinal hernia is above the femoral hernia. The femoral vein will be compressed, so you will not see the femoral vein. Abnormal lymph nodes will be round or asymmetric in shape, non-uniform cortical thickness, loss of normal echogenic hilum, and a peripheral or mixed pattern of blood flow. These are the features of abnormal lymph node.